We needed that heart. We were desperate for that heart. Reed was born at Conway Regionals on April 5th. He was born into the world perfectly healthy. We were able to go home the following day, but then 2 days later we were readmitted for his jaundice levels. And he eventually overcame that, and then we were able to go back home on a Wednesday. And then starting that following Saturday, he started acting not right. Just something was off, and we knew immediately we needed to take him to get him checked out. And on the car ride from home to the Arkansas Children's ER, he just started crashing. And I ran him into the ER and was greeted by the receptionist, and the way she responded to the nurse, to the trauma team, I mean, everybody just worked as a team and got right on Reed. They were just trying to figure out what was going on, but he was already in heart, kidney, liver failure. They immediately placed him on ECMO life support, and for 6 days we had a roller coaster of a ride, but he eventually became strong enough to come off of ECMO life support.
So Reed was born with actually a normal heart, and when he was about a week old, he developed a viral illness which unfortunately affected his heart. And was presented to an outside hospital where he had cardiac arrest. He initially was transferred here and placed on life support for about 1 week, and though he was able to get weaned off of that, his heart function never recovered. He held his own for about 3 months and then began to get sicker, and when his clinical status became such that his native heart could not support him, he was hospitalized in July of this last year. He was then placed on the transplant list and had to wait.
We love Dr. Kinnett. He's really wonderful at being able to explain your child's condition. He takes the time to really talk with you about it, to make sure you fully understand, and prepares you for it. I mean, before we knew for a fact Reed was going to need the transplant, he was talking with us previously about it just so we were well prepared for if it did take that route, which it did. So we were able to really prepare ourselves for that.